Hello, Manawal, Winnie Laban.
Yeah. Mr. Chair, kia ora talofa lava and warm Pacific greetings. As I stand to speak on the Appropriation 2008 and 2009 financial review, I do stand heavy with heart and with sadness as I reflect on this national government who continually use rhetoric and nonsense over logic and common sense and labelling cuts as changes. And let me just prepare a snapshot of some of the changes. And what we're talking about are the impacts on our families, our communities, our elders out there in the community. March 2009, Taranaki DHB has publicly signalled that its hospital is preparing for cutbacks. April 2009, Southland and Otago DHBs have confirmed they are cutting home-based services to reduce costs. The boards were looking to make savings of up to $10 million by reducing home-based support for elderly. May 2009, cut the anti-obesity, oral health and mental health targets. National have taken $2.3 million out of cancer controls in the budget 2009. They've slashed the diabetes Let's Get Checked budget by $4.8 million each year. They've cut $3 million from the cardiovascular disease budget, and mental health services have also had their funding cut. In June 2009, Wanganui DHB said it will be closing housing hospital wards on weekends to save money on nursing overtime. The Fruit in Schools program, which currently provides 100,000 children with fresh fruit each day, is under threat. The South Canterbury DHB in July 2009 said it will be reducing the amount of patients seen in its emergency department by up to 5,000 people a year. In August 2009, cuts to elderly care in South Canterbury. Rest home care limits annoy the GPs. In Dunstan Hospital, reduces community, physio and disability home support. In September 2009, $2 million cut in mental health services for the Nelson Mental Health Funding. October 2009, home support cuts for elderly in Canterbury. Let me quote from Christchurch Press, old man offers to wash his shower with his foot. In November 2009, a total of 12.5 nursing positions chopped across the Palmerston North Hospital's main surgical, medical and child health wards. In December 2009, the survey shows spending down on GP visits, surgery as well. Research commissioned by the Southern Cross showed that results found that the number of people who visited their GP when they felt unwell fell from 64% in 2008 to 56% this year. And senior doctors voted overwhelmingly to focus on achieving a pathway to try and better conditions. January this year, Mary Burke, DHB board member candidate on ACC Squeeze, said so effectively, Madam Chair, what are we talking about here is that ACC is trying to cut down on its costs by shoving its responsibilities onto someone else. Assessment cuts for elderly. More than 1,200 Canterbury elderly have had their home help hours cut or reduced since the new assessment service. And we've got numerous stories in part of my electorate in terms of the Mana Kapiti electorate where the home-based cuts are being assessed via the telephone. We've heard these stories all over the country. And what's really disturbing is the anxiety, the stress that is caused, for example, in my electorate of Mana Kapiti. 24% of Kapiti are over 65 and people are worried. I mean, if we look in terms of the elder example, we're actually talking about over 28,000 people in rest home care, over 60,000 people who receive home-based care. It's cheaper and much more cost-effective to continue to give that little bit of support to enable our elders to continue to live independently and in their own home. And at the end of the day, this particular group are very important to our society because they hit us at a personal and intimate level because they are our parents. parents. They're our grandparents, and they're people who've contributed and built the society. And is that the sort of reciprocity that we want? So at the end of the day, Mr. Chair, it's sad to see a lot of programs that Labor actually embedded and needed more time to continually produce the achievement levels that we're already showing. Thank you, Mr. Chair.
Dr. Paul Hutchison.
Thank you, Mr. Chairman, for the opportunity